Hi there and welcome to the Health Sphere, where we provide health advice based on our personal experiences, research, and what's worked for others. But remember, this information is for general knowledge and should not replace advice from your own healthcare provider. Today, we will discuss genetic testing. Now, this is something that I get asked about quite frequently. People want to know, is it worth doing? How does it work? What exactly is it? So in this video, we'll try to answer some of those questions. First off, let's look at why someone might choose to get tested. Well, there are many reasons. Some people want to see if they carry genes that could be passed down to their children. Others want to know if they have certain gene variants that make them more susceptible to certain diseases. And still others just want to understand their own biology better. There are three main types of genetic tests: predictive, diagnostic, and pharmacogenetic testing. Predictive or pre-symptomatic testing is used to determine whether an individual has a genetic variant associated with a particular condition. The results may help individuals make informed decisions about their health, such as whether to have children or to undergo preventive measures. However, it's important to note that predictive testing cannot tell you when or if you will develop a condition. Rather, it shows whether you have a genetic variant linked to that condition. For example, BRCA1 and BRCA2 are two genes that have been linked to an increased risk of breast cancer and ovarian cancer. A person who inherits a mutated version of either of these genes has a significantly higher risk of developing these cancers than someone who does not carry the mutation. If you have a family history of breast or ovarian cancer, and you would like to learn more about your risk, talk to your doctor about getting tested for BRCA1 and BRCA2 mutations. Diagnostic testing is used to identify or confirm a condition or disease in someone who is already showing symptoms. This type of testing is often used in conjunction with other tests and procedures to help doctors make an accurate diagnosis. For example, if you have a family history of cystic fibrosis and you are showing symptoms such as persistent coughing, difficulty breathing, and frequent lung infections, your doctor may order a genetic test to confirm the diagnosis. Cystic fibrosis is a genetic disorder that affects the lungs and digestive system and causes the body to produce unusually thick mucus, leading to serious lung infections and other complications. Pharmacogenetic testing, on the other hand, is used to determine how a person's genes may affect their response to certain medications. This type of testing can help doctors choose the most effective medication and dosage for a particular patient based on their genetic makeup. For example, a person's genes can affect how quickly they metabolize certain drugs. If a person has a genetic variant that slows down the metabolism of a drug, it means that the drug will stay in their body for longer than it would in someone without that variant. This can lead to higher levels of the drug in the body and an increased risk of side effects. By understanding how a person's genes affect their response to medications, doctors can choose the safest and most effective treatment options. For example, if a person has a genetic variant that makes them more susceptible to the side effects of a certain drug, the doctor may choose to prescribe a different drug with a lower risk of side effects. It's also worth noting that genetic testing can have a significant impact on a person's life. The results of a genetic test can raise a number of ethical, legal, and social issues such as discrimination, privacy concerns, and reproductive rights. It's important for individuals to understand the potential impact of genetic testing before undergoing any testing. Genetic tests can be expensive and may not be covered by insurance. The cost of testing varies depending on the type of test and the company that performs it. Some tests can cost hundreds of dollars, while others can cost thousands. Additionally, genetic testing can be emotionally and psychologically challenging for some individuals. The results of a genetic test can provide a lot of information about a person's health risks, but they can also raise more questions than answers. For example, if a person tests positive for a genetic variant linked to a particular condition, they may wonder how likely they are to develop that condition. Or if they have a child, what is the chance that the child will inherit the genetic variant? These are difficult questions to answer and can be emotionally draining to deal with. Overall, the decision of whether or not to pursue genetic testing is a personal one that should be made in consultation with a healthcare provider. There are many factors to consider, including the potential benefits and risks of testing, as well as the emotional and financial toll that it can take. Remember that genetic testing is not always straightforward, and the results of a test may not always be clear or provide all the answers you are looking for. Now, let's talk about how genetic testing works. There are several methods used to test for genetic variations. The most common method is called polymerase chain reaction, or PCR. PCR is a laboratory technique used to amplify DNA, meaning it makes millions of copies of a specific DNA segment so that it can be analyzed. This is important because many genetic tests require a large amount of DNA to be analyzed. But the amount of DNA in a sample like blood or saliva is usually very small. PCR was actually discovered in 1983 and is considered one of the most important inventions in the history of genetics. The inventors of PCR won the Nobel Prize in Physiology or Medicine in 1993 for this discovery. PCR has revolutionized many areas of genetics research and has had a major impact on our ability to diagnose and treat genetic disorders. In addition to its use in genetic testing, PCR is also widely used in forensic science to amplify DNA from crime scene samples. It is also used in evolutionary biology to amplify ancient DNA from fossils and in personalized medicine to amplify tumor DNA for cancer treatment. Another method used for genetic testing is called DNA sequencing. DNA sequencing determines the order of nucleotides or building blocks of DNA. This can be useful for identifying genetic variants that may be associated with a particular condition. DNA sequencing has allowed scientists to determine the sequence of all the genes in the human genome and has led to many advances in our understanding of genetics and disease. Now let's discuss how to prepare for genetic testing. First, you need to choose a testing company. There are many different companies that offer genetic testing services. Some popular ones include 23andMe, Ancestry, MyHeritage, and Family Tree DNA. Each company uses different methods and technologies to analyze DNA. So it's important to do your research and choose a reputable company that uses proven methods and technologies. You may also want to consider the privacy policy of the company to make sure that your genetic information is protected. Some companies allow you to share your results with relatives, while others keep your results private. You need to decide what you are comfortable with before ordering a test. Once you've chosen a testing company, you'll need to collect a DNA sample. Most companies will provide you with a kit that includes everything you need to collect your DNA. The process is usually simple and painless. You will typically need to provide a saliva sample. Just spit into a tube. Some companies may also accept cheek swabs or blood samples. Once you've collected your sample, you'll need to send it back to the company. Be sure to follow the instructions carefully to avoid damaging the sample. After receiving your results, it's important to review them carefully and understand what they mean. Many testing companies will provide you with a report that explains your results in detail. It's also a good idea to talk to a genetic counselor or other healthcare provider to help you understand your results and what they may mean for you and your family. Remember that genetic testing is a personal decision, and it's important to weigh the pros and cons before deciding whether to get tested. Overall, genetic testing can be a powerful tool for learning about your health risks and making informed decisions about your health and well-being. However, it's important to choose a reputable testing company. Follow the recommended guidelines for sample collection and be prepared to review your results with a qualified healthcare provider. By taking these steps, you can ensure that genetic testing is a safe and informative experience. So if you're considering genetic testing, be sure to do your research and choose a reputable testing company. Follow the recommended guidelines for sample collection and be prepared to review your results with a qualified healthcare provider. And that's all for now. I hope you found this video informative. If you did, please hit that like button and subscribe to our channel. Thanks for watching, and stay healthy, my friends.